Governor Roy Cooper's statewide shutdown order has pushed North Carolinians to embrace virtual technology for all sorts of things, everything from weddings and funerals to shopping to education and certainly health care. Could it be that this pandemic will usher in a new acceptance of what's known as telemedicine or more broadly telehealth issues? Well, a new paper co-authored by experts at the John Locke Foundation and the Brookings Institution takes a look at the potential and the challenges for this innovation. Jordan Roberts is the healthcare policy analyst at the John Locke Foundation. He is a co-author of this report, joins us now to talk about it. Jordan, welcome back to the show.
I'm glad to be here.
So overall, give us a sense of how COVID-19 has impacted the adoption of this digital technology when it comes to access to health care and medical treatment.
So I think there's two main things. First of all, as you mentioned, the stay-at-home orders, people's access to their typical doctor's office or everything, accessing that changed. So, we saw people that, they might not feel comfortable going out, may not want to go to the doctor's office for fear of contracting the disease. So they opted towards more virtual visits. And so a lot of people were talking to their doctors, getting consultations that way. But then the other reason was that, when thinking about fighting this disease, we want to keep our frontline healthcare workers less susceptible to the disease as we can. And so if you're feeling under the weather, you think you might have some of the symptoms of COVID, checking with a doctor over a virtual visit first may, decrease the number of interactions you have with other people and make sure that if you truly have the virus, then you can get proper directions on how to get to the hospital, where to go, what to do, things like that. And, another thing is that a lot of the healthcare professionals may be in that high-risk category of susceptibility to contracting the disease. So keeping them separated, allowing them to still do their job, but over virtual means was one of the ways to, decrease the amount of interactions that you might have with somebody. So a lot of those were reasons why more people started to use it, but also a lot of the regulations, like we'll talk about.
One thing that I've noticed is it seems like what is different about it that I have noticed during COVID is we're kind of used to the idea of communicating with someone virtually. You can do it on your phone, you can do it on your laptop, and, having a conversation. But it seems now that we've taken a step further, and perhaps more people have, where you can actually be monitored. Maybe you have a piece of equipment at your home with you where you can assist the medical professional that's joining you virtually in monitoring whether it's your blood pressure, your heartbeat, or your medication level or whatever. It seems like we've kind of added that layer to it during COVID.
Yeah, absolutely. And that's one of the biggest things that, as we researched for this paper, we were looking for ways to, how can we increase the adoption and just a general level of comfortability with the technology and, people have, generally gone to the doctor's office to get their care, and now, accessing it over their iPhone or through a computer may feel a little unfamiliar or not right in a sense. And so, just, increasing these options have allowed people to see that, it can work, it can supplement the normal delivery of care. And as people get more comfortable with it, just like new innovations all over, it becomes, more widely accepted and just, people feel better about using it. They think they can get that same level of care because a lot of times it can be provided over virtual means.
COVID has also focused us a bit more, I think, Jordan, on the issue of required technology in order to do this and broadband. And there are some places in North Carolina and across the country where people don't have access to higher speed technology, et cetera, particularly people who are maybe at the modest end of the income scale, or they live in a remote area where there might not be a private provider that gives them access to higher speed. Talk a little bit about that challenge for telemedicine and telehealth.
Yeah, so one of the greatest things about telemedicine is that it can connect people over great distances, and it really increase access for people who may not have the supply in their area. But it's only as good as your ability to connect to the other doctors and things like that. So rural broadband and just broadband access in general are huge issues because you can't connect to somebody without that. So as we look towards the future, yeah, we need to look how can we make sure that in these medically underserved communities or these medical deserts, we know that there's not enough healthcare supply in that area, but in order to bridge that gap, we need to connect people. So looking for ways to encourage, private broadband companies to get out there, that's going to be really important in the future.
And that's a big challenge because what do you do if you have, let's say I'm a broadband company owner, and I know that there is a need somewhere in North Carolina, but I know that, let's say it's going to cost me money, that I won't be able to make money in order to do that. So that's a really tough discussion we have to have with policymakers here about how we go about this.
Yeah, absolutely. And, especially in a state like North Carolina that we have a very, very rural population, one of the, I believe, the second biggest only behind Texas. So this is a large part of our population that we're going to try that, we think that this technology can help. And so it's just part of the equation because, like I said, your access to doctors over telemedicine is only good as your connectivity. So, yeah.
So connectivity, one big issue, but in the report that you co-authored with the folks at the Brookings Institution, which, by the way, is available at johnlocke.org, it's also an issue of connectivity to a medical professional. There are people who are highly skilled, but as you detail in the report, Jordan, because of certain antiquated rules and things like that, I can't get access to someone who maybe is the best person in the world who knows about that rash I've got on my arm, but maybe that person doesn't technically practice in North Carolina.
Right. So, telehealth, I think, illustrates the problems with the way that we've unleashed this licensure system in our country. In most states, you need a medical license to practice in that state, to treat patients in that state. But, not every doctor wants to get a license for all 50 states. It just doesn't make sense. It's redundant, more costs and everything. And so one of the big regulations that we saw waived during the COVID-19 pandemic was a lot of these licensure requirements. So, Governor Cooper and a lot of other governors waived these requirements. So people in North Carolina can be seen by doctors from out of state because, like we see, there's a maldistribution of healthcare providers, and so this genius of telemedicine allowing us to connect over long distances. These antiquated laws, as you said, limit you to just the state borders, and so that's really one of these old regulations that just inhibits people from accessing telehealth, and we should unleash it to allow patients to access it at the highest level possible.
It's curious, isn't it, Jordan, that in an emergency, our policymakers, so whether it's the governor or legislators, seem to just intuitively understand, hey, this rule is an impediment, and we need to, because we're in an emergency, get rid of that thing so that we can take care of the problem that we have. Seems like common sense that once we make our way through the pandemic that they would all sit down across the table and say, you know what, if it made sense then, it makes sense now.
Absolutely. The irony lies that, organizations like ours at the John Locke Foundation, we've been advocating for a lot of these policies and just these general theoretical principles of just, deregulation and, just no restrictive or protectionist policies for a long time. And so, going forward, I think there's no reason that we should revert back to any of these restrictive policies.